Whatever you're going through, whatever you're facing, we'll support you through it, and we're here to help.
Hi, I'm Jessica, an outreach coordinator at the Spary Center, and I want to talk today about managing media consumption and mental health. Media is unavoidable. That is especially true now during this pandemic, where we're getting so many updates on what's going on locally and around the world as it relates to the virus. It's important to get this information, but it can also be very overwhelming and anxiety-inducing. When we hear or read negative, scary news, it triggers the fight, flight, or freeze response in our brain and body, pumping out adrenaline and the stress hormone cortisol, because our brains perceive and process this as a real threat that's happening to us right now. Media tends to take advantage of this fear response to grab our attention. We can't help but get swept up by sensational news because our brains are wired that way to keep us safe. There are also some cognitive biases that occur when you process news, such as optimism bias, which is the bias that something negative is less likely to happen to us than other people. This could lead to others not taking precautions seriously enough to prevent the spread. Probably the biggest one is negativity bias. Negative events have a far greater impact and stick with us way more than positive ones. This is why we focus so much on sensational, fear-based news stories. It's important that we're aware of these different biases so we can prevent them from taking over our thinking. Constant exposure to negativity in the media can also take a toll on our mental and physical health. There was a study actually in past epidemics that found that people showed symptoms of PTSD and experienced acute stress when they read repetitive, sensational news stories. They also had poor health and well-being overall. People were also found to be less kind, less helpful, and more distrustful towards others when they consumed a lot of negative news. It affects our decision-making and rational thinking ability too if we're operating on fear, especially in times of uncertainty, which is why there's been hoarding of weird things like toilet paper, which has nothing to do with the coronavirus. It's just harder for people to think clearly. But there is hope. We can be more mindful and intentional about the media we're consuming and take back control. We can do this by turning off or muting notifications, limiting the amount of news that you watch and designating a time once or twice per day to get updates. Choose a few reliable news sources to get your information from, like the CDC and WHO, because they're going to have the most accurate information and they aren't trying to sell you a story. Avoid emotional clickbait, especially in social media. It's meant to just grab your attention and take advantage of the brain's fear response. And if checking the news is still too overwhelming for you, have a friend or trusted adult give you updates, as long as they're also using accurate sources. And to combat that negativity bias, actively seek out positive and solutions-focused news. And when you do find some good uplifting news stories, share them. Media can also be a powerful tool to promote kindness, positivity, and connection with one another. When we see others helping, it inspires us to want to find ways how we can help too, like the stories of people 3D printing protective gear and sewing masks to donate to local hospitals. But be wary of misinformation out there. In times of uncertainty, there is an uptick in the spread of fake news and misinformation. So it's important to be skeptical and really think before sharing an article, negative or positive. The semi-recent story about dolphins returning to the Venice canals has sadly been debunked, so it's not just fear-based stories being spread inaccurately. Here's some tips on spotting bad information. Always check the source where you're getting the information from, especially if it's being spread in social media. Does it include quotes from experts or other people? Can the info be found on another site? If it doesn't have these, it may not be that accurate. Look at the publisher's or the news site's credibility. Do you know who the author is? Does the domain have a weird ending like .co? Make sure it's not actually a satirical site like The Onion. Even though I love The Onion, not great for spreading factual information. Take a look at the quality of the article too. Does it have a ton of spelling errors or weird punctuation? It may not be a credible site. Double check it's not old news being recycled and taken out of context too. And always, always, always read news thoroughly and fact check using sites like Snopes and factcheck.org. Don't just read the headline and take it for what it is. The headline can be misleading. And like I said before, not all media is bad. It can be a great tool for empowering and uplifting each other. Social media is kind of essential right now to stay connected with friends and family as we continue to socially distance. You have control over creating a positive digital community for yourself. You got an aunt who's sharing way too many anxiety-inducing posts on Facebook? Use her profile for a bit. You have agency around what you expose yourself to. Now, that doesn't mean you completely tune out what's happening, but staying informed in mindful, intentional ways will help you manage stress and anxiety.
Spary Center is a therapeutic learning program of Educational Service District 112. For more information, visit sparo.esd112.org. If you or someone you know needs help, contact the National Suicide Prevention Lifeline at 1-800-273-TALK or through an online chat available 24/7.